Okay, good. Which of the following hormones would be expected to have elevated levels in this patient? Estradiol, FSH, LH, progesterone, or prolactin? A 17-year-old phenotypically female patient with primary amenorrhea and no breast development is diagnosed with androgen insensitivity syndrome, AIS, after a karyotyping analysis reveals a 46XY genotype. Which of the following hormones would you expect to have elevated in levels in this patient? So this is the one, and again, it always stuck with me because you said this. These are the people who look like models. Like these are the people
Yeah.
who have like, they have no hair. They're always very tall. They tend to be like, very thin. And so I know that I can identify it. With that, which of the level will be high in this patient? Um, I don't know. I don't think it's prolactin.
Okay.
I don't think it's estradiol. I don't think that. Progesterone? I don't think it's progesterone. I could be already wrong, but I don't know.
So this one's
Inhibit
I say is a little bit tricky. Let's work through it together. I mean, let's work backwards at least, right? So
yeah.
this one's definitely a difficult question. So we know the diagnosis they already gave that, which is nice of them, right? So
Mhm.
AIS, androgen insensitivity syndrome, right? So in your mind, before I look at the answers, right? If I didn't see the answers, what was expected at high levels? The most immediate answer would be what? Testosterone, correct?
That's what I was thinking immediately.
Okay, good. Right. So obviously they're not going to give us that easy of a question, right? And so testosterone is not one of your answer choices. But then you have to think of, okay, so in a sense, right? Genetically female or genetically male here?
Genetically male.
Genetically male, right? So already in my mind, I'm thinking, okay, so unlikely progesterone, unlikely prolactin, right? And so then you get FSH, LH, and estradiol. Okay. So talk to me about LH and FSH first. That's gonna be the initial ones, right? So will they be elevated or decreased if you have high testosterone? Does that make
Man,
sense what I'm
I
trying to say?
yeah, I know I get what you're saying. I'm honestly have never been good with for some reason these like just always leave my mind.
Sure.
FSH I know is gonna be like a lot of things like inhibin and like uh it also deals with like tight junctions or LH. I know. I always get lost here. Um,
Sure. So the best way I remember is that these are okay. So you talk about like, in a sense, right? These patients usually have like testes, right, that are undescended, right? Things like that. So those testes are your body's making tons and tons of testosterone because you feel like the receptors aren't functioning correct, right? And so the brain itself, if you think about it, should in theory, right, decrease LH and FSH. I could be wrong, but that's how I think of it in this particular situation with AIS. But then you're thinking, if you have too much testosterone, what did your body like to do with that testosterone?
I don't know.
It likes to convert it to estradiol, if I'm not mistaken.
Oh wow.
Yeah,
Some
so that's
aromatase.
how I would, yeah, that's how I would approach this question. And the reason why is let's kind of bridge to another concept here. So if you have like a female that has a high BMI, right,
Mhm.
what ends up happening?
They end up having a lot of overwhelming estrogen. They're higher risk for endometrial cancer.
Yeah, good. And sometimes that estrogen turns into what? Testosterone, right? And so people that are super obese can
Oh
have,
yeah,
yeah, a little bit
PCOS
more.
and hirsutism and
Yeah, exactly. Right. And so that's what I think. But let's kind of see, kind of, work through this together because, some of these kind of get really tricky, as you already know. Okay, so let's look at it together. Let's see. Estrogen primary produces ovary in females. It's not ovaries, therefore estradiol. Maybe it's a certain type of estrogen, but I gotta look this up again because I'm pretty sure for some reason in my mind I think it is. The answer is estrogen. But let me see. LH, androgen sensitivity, and then 46 genotype due to a mutation, androgen receptor mutation, lack of testosterone, AAH, testes are present but often undescended. There's no uterus, but lack of response to androgen results in increased LH due to lack of negative feedback on the hypothalamus. Okay, so let's take a look at here. That could be correct, but I just want to, sometimes this is how I think about stuff, but let's see if I'm
mm,
correct here. Um, AIS, elevated estrogen and testosterone. Let's look here. Yeah, it seems like both are. LH and no, hold on. Let's see. Androgen. Let's see. Estrogen. Let's see.
I'm also trying to look this up.
So the answer might be LH. Maybe I have a misconception, which that does happen.
It happens to the
It
best.
happens. Let's see. Maybe it's only female that have genetically female that only have the aromatase. Maybe that's the thing.
Well, I think it's both. I think you're right. I'm looking it up right now, and it says that you have a loss of negative feedback, which results in increased testosterone and LH, but you have an increase in estrogen due to conversion of excess testosterone via aromatase.
Yeah, that's
So
what
it
I
may not be estradiol because I think there's like three types of estrogen.
Yeah,
And
I think that's
so,
the key. That's the key. I think this is not the same. Estradiol, I don't think is the correct hormone because I know estrogen does rise, but I guess estradiol doesn't. Okay, that makes more sense to me. But
for
yeah, I
sure.
guess LH is going to be our best answer here, which makes sense, right? If I'm working through it a little bit better here, so you have too much testosterone, but the receptors aren't working. If the receptors aren't working downstream, then your pituitary is going to be like, okay, so I want to create a lot more LH to produce even more testosterone to get the results that I want, right? And so this
Mhm.
ever ending feedback is going to keep going, which is why your LH is going to be elevated. So that makes sense.
Yep.
All right, perfect.